Great. Let's go ahead and go to the next slide. Thank you so much for introducing yourself in the chat. Please continue to do so. If you've just joined us, welcome. We would love to learn who you are and the organization you're representing. If you can go ahead and put that in the chat. Welcome to Connecting for Better Health. We start every meeting with our vision and our policy priorities for the year. The Connecting for Better Health Coalition vision is that every Californian and their care teams have the information and insights they need to make care seamless, high quality, and affordable. Our 2025 policy priorities are listed here: establishing DXF governance and accountability, identifying dedicated and sustained funding streams, strengthening social services data sharing, and advancing high quality and actionable data sharing. We can go ahead and move on to the next slide. We have a great agenda for today's meeting, a number of guest speakers who have graciously joined us. Thank you so much to all of you for taking the time to be with us today. We're going to speak about some of the recent California Data Exchange Framework developments, including the participant survey and a proposed amendment currently out for public comment related to the technical requirements for exchange policy and procedure. We're also joined by David Ford of the California Medical Association to share a bit about the recent Health IT Summit QHIO pre-conference workshop and key takeaways. We're also joined by Max Perret of Aliados Health, who's going to give us a little debrief on what's going on with the state budget. This is a big week for the state budget process for those of you who have been following closely. And we'll wrap up with some quick updates related to Senate Bill 660, Menjivar bill that Connecting for Better Health is sponsoring this year on the data exchange framework, as well as a few federal updates, including this health technology ecosystem RFI that many of you have contributed to. Great. I think with that, we can go ahead and move on to our first agenda item. I see we still have a number of folks coming in from the waiting room. Welcome if you're just joining us. But I'm going to go ahead and pass it over to Jacob to introduce himself and speak a little bit about the DXF 2025 participant survey. Jacob, all yours.
Yeah, so I'm Jacob Parkinson. I'm the Deputy Director here at the Center for Data Insights and Innovation, specifically overseeing the data exchange framework in partnership with so many of the folks on the team. I have been in this role for a little over a month now, so very fresh to this team, but there's a tremendous amount of work being done to advance the secure exchange of health and social service information. But really, as we step in here, we're trying to establish a number of different things. We're trying to advance event notifications, advance social service data sharing. And one of our roadmap pillars is to actually start measuring the success of the work we're doing. So we have a number of quantitative metrics measuring transaction volumes more than anything to start. And we are starting to look at how we can actually measure the qualitative feedback from our participants. So we sent out a survey to every single DSA signatory a few weeks ago now, and that survey is just about coming to a close. So it's actually going to close tomorrow, June 13th. I encourage all participants to send this in. It's like a census of sorts. We will use this data to actually start defining where and how we move the direction of the framework. It's anonymous, and we just ask for some information about your facility type, for instance. If you have any questions or if you didn't get that survey, please do reach out and we can help point you to it.
Thanks so much, Jacob. Are you able to share at all around what information might be available to the public after the survey closes?
Yeah, absolutely. So we'll be sharing kind of an aggregated look at the results of the survey. What we're largely collecting is, well, first, where are you at in your stage of interoperability? Are you using an electronic records as a system? Do you actively exchange data today? But then we also get into the weeds on a couple of different very specific things. Are you receiving ADT notifications? Are you receiving them to the extent that you want? So we'll give everyone a high look at the results of this survey just in the aggregate at our upcoming IAC meeting, which is open to the public here next month in July.
Great. Thanks, Jacob.
Yeah.
Any questions from the group related to the survey? Hopefully many have taken it or someone in your organization has. Okay, not seeing any. Thanks, Jacob. We look forward to seeing some of those results. I think we can move ahead to our next item on here, which is the technical requirements for Exchange P&P amendment that is out for public comment. Jacob, would you like to do a brief introduction before we talk a bit about it as a coalition?
Just to say, I think these are there's a lot of changes here in this PNP. We are invoking changes from the standards committee that were recommended from the standards committee and previous technical advisory committees. We are trying to align with our strategy for digital identities in many ways, but there are many changes in here. So if you have questions on individual, I'd be happy to help support and talk them through. But Stephanie, no, feel free to jump in.
Awesome. Okay, well, Olivia, I'll pass it over to you for our summary.
Sounds good. Yes, we'll review. If you wouldn't mind going back a slide, Maya. We'll get into the specific changes in a minute, but just wanted to make sure that everyone is aware that the public comment period for this closes on Monday, July 21st. There is a specific DXF comment template, an Excel spreadsheet to use when giving public comment, and partners are able to email that to cdii@chhs.ca.gov. And of course, C4BH will be preparing comments. An overview on what the technical requirements for Exchange P&P is that it really outlines the minimum baseline for technical requirements for how health and social service information is to be exchanged under the DXF. And if you can go to the next slide, this definitely is not everything. There are many substantial changes included in this proposed amendment, but here are some of the highlights that we wanted to flag for the coalition. There is the removal of specifications for technical standards that were previously in the PNP that dictate how participants exchange data using the national networks or frameworks. I think this has been removed for redundancy because these networks, national networks and frameworks govern themselves and set their own standards. So there's no need to, add that extra detail in. There's also an amendment to transition the language that we use for event notifications to be from notifications of ADT events, admit, discharge, and transfer events, to simplifying it to event notification, which aligns with the language in the DXF roadmap. And it does also allow for future event types of events to be added to these required notifications. But currently the PNP continues that the only required notifications at this time are for admissions and discharges. The PNP, the proposed amendments do propose extending these event notification requirements, which currently are in place for hospitals and emergency departments, to also include skilled nursing facilities beginning in 2027. And then in alignment with, as Jacob was mentioning, in alignment with recommendations that came out of the Standards Committee and the IAC from last year, there are some proposed amendments around minimum data content and format standards around event notifications, and then also for the rosters for event notifications. These include requiring event notifications to be made available in both human and machine readable formats, including a technical standard for machine readable notifications, which is using HL7 ADT format, and then also establishing minimum data to be included in event notifications for both admissions and discharges, and similar as well with establishing minimum data elements that are need to be included for rosters to request and receive notifications. And then finally, the other one we wanted to call out here is that the proposed amendments clarify that sex and gender-related attributes should not be used for person matching unless it is required to conform to an underlying technical standard. But here's I would say, a high-level summary of the key points that we want to bring to the attention of the coalition.
Any initial thoughts, reactions from the group? Pieces that stuck out to any of you who have had the chance to review this thus far?
John Helvey from Sac Valley MedShare. Just clarification around the sex for patient matching. That is a prime principle of patient matching right now. First name, last name, date of birth, gender/sex. So I'm kind of confused by by that? Can somebody bring some clarity?
Jacob and/or Rim, is that something you would want to speak to?
Can kick it off, and Rim, feel free to add any details. Our technical requirements for Exchange PNP has always prohibited the use of gender for patient matching. So this is really just an expansion of that. I think the intention when this PNP was created was to use the HL7 definition of gender, which included sex, but it's misleading how it's written. And so this is really just to align with the strategy for digital identities. Now, the strategy at the time, when we created it a couple of years ago, had several focus groups that requested that data point not be included for person matching. And this is just to align with their feedback and the strategy in general. So it's really to clean up the language here, but we welcome all public comment on this. If folks disagree with that, please do submit your comment. Rim, anything that you would add?
Nope, I think you covered it. Thank you.
Other questions, reactions? Okay, I think we can move ahead to the next slide. Olivia, if you want to share a little bit about our public comment process. Olivia, I can't hear you. I don't know if that's just me.
Apologies. Sorry about that. Yes, our public comment, our development process will begin by having a conversation and getting feedback from coalition members today. We will also then take back, the conversation from today, recommendations from our staff, and develop public comments that are then shared with our advisory group, which we will make sure to then report back on and circulate with the coalition for further feedback before they are submitted. I would say in general, from what the C4BH staff have reviewed so far, we are supportive of the proposed amendment, but do have additional considerations that we are interested in mentioning in our public comments. We agree with the minimum data that has been specified for the event notifications around admit and discharge, but there are two additional data elements that we would recommend for inclusion. Which include discharge to location if applicable, and then also patient preferred language, which we learned through our design studios with the DXF Community Sandbox. These two elements are really essential to support care coordination efforts. And if they are available, we would like to encourage those to be included in these notifications. We'd also like to continue having a bit more discussion around the language in the proposed amendment on encouraging event notifications to only include the information necessary to make a participant aware of an event happening, and then also to enable them to request additional information. We do have concerns perhaps that this additional step could result in delays which can harm care coordination. And we've heard from partners that oftentimes this information is not immediately available to query through the request for information process. So we'd love to continue to get feedback from the coalition there and continue to get input on that bullet. And then the other two that we intend to provide public comment on is around, we agree with having minimum data for rosters, but believe that, additional format standardization will be really meaningful to help enable more seamless patient matching across rosters. And then finally, on this point about transfers, currently the PNP only requires event notifications for admit and discharges, but we would like to encourage participants to be able to request event notifications for transfers at their own discretion, which could be a way to balance, the operational burdens of getting, hit with way too many notifications, but also still being able to request the types of notifications, transfer notifications they would like to have information on, to not, deter this very valuable type of event notification. Robbie, I see you have your hand raised.
Yeah, thank you, Olivia. I think on your first sub bullet there, I think we're still reviewing and trying to shape what our feedback and positioning would be. But I think one initial thought is that while certainly event notifications serve a purpose for awareness, right? I think as you mentioned, right, we need them to be sufficient to be acted upon. And so including only the information necessary to make it to make the receiving participant aware of an event, I think I'm not sure if that goes far enough, right? Because the purpose of them really is to not just give us an alert, but provide information that we can act on to say start care coordination, prior auth, et cetera, right? So I think that's one key issue that certainly Blue Shield will be looking at and looking to provide feedback on to you all and through our trade associations too.
Thank you. Yes, Robbie, I love the way that you worded that about making ADT notifications be meaningful and actionable as well, and something we'd like to continue to look at. Are there any other comments on these points? We'd love to hear from folks. Especially we know transfers can be a sticky issue that we'd like to continue having more conversations around.
Yes, this is Gavik Nalbandian. I had a question. I put it in the chat, but I'll ask for the two fields you were asking for, preferred language, I'm assuming, and the location. Preferred language, I'm assuming we could use the coded value from HL7, but location is a little bit nuanced. And is that a free-form location? Is it a directory of locations that's selectable? Because if that's ambiguous or unresolvable, I'm wondering if wrong or misinterpreted information can cause more harm than lack of information. So I'd like to know what you think about inclusion of location.
Great question. And I wonder if anyone from our Sandbox team might be on today. I know that that is a set element. I'm not sure at this time if it is something that is free form, but I think that's a great consideration for us to look into and make sure we clarify in our public comments.
Hey Olivia, this is Robbie again. I think I'd second that idea, and we can loop back in with our colleagues on the issue too. But I know this is an ongoing concern, just around not just one getting location data, in say an ADT, but also what specific data is included, how you list out a facility, whether it's using an MPI, a formal name, whether you're using abbreviations to spell out the name. I think this is certainly an issue that we encounter with ADTs through all the different methods we're getting them. So I think we'll be looking to provide some input on that issue.
I think there's also issues. I mean, anybody that works with this data on a regular basis, we establish code sets for transformation. And those aren't readily, those aren't the same across all organizations. So getting them to map to like data is a challenge. So, and it's a process. I wouldn't say it's a challenge, just a process. So, from a raw ADT perspective, I'm not sure the actual data within the ADT is helpful without those code sets.
Mm-hmm.
Correct. So the argument isn't not to include it. I think it's important. The more information we have, the better. It's just it's important for it to be resolvable to something that's actionable.
Yes, these are all great points. Thank you.
Olivia, can you remind us on how we're going to shape these comments so that we can include some more detailed thinking? So what's our next step?
I imagine that, perhaps we'll get into discussion at this at office hours. we will definitely be taking this back and discussing it at our next advisory group meeting. And we will also be sending out our draft comments to the coalition to additionally get feedback. So we'll make sure that there are multiple opportunities for folks to engage and dive more into these issues.
But let's have a more detailed discussion and point of view in our office hours.
Timmy, I think you might have cut out at the end for me, but definitely agree. We will continue to develop a more specific point of view on these different topics with clear recommendations. All right, and I think with that, we have a lot more on the agenda for today. So I think we might be ready to move on into our next agenda item. All right, we're excited to welcome David Ford, who is the Vice President of Health Information Technology at the California Medical Association, to come share his takeaways from a recent DXF pre-conference workshop at CMA's Health IT Summit.
All right, well, good morning, Olivia and team, and just so I know, oh, okay, yeah, you have my slides.
We got them.
Great, well, thank you for having me on this morning. Yeah, as Olivia mentioned, at the CMA Health IT Summit last month, May 6th and 7th in San Diego, we tried something new, and we did it in partnership with Timmy and the Connecting for Better Health team, which is for the first time this year, we built in a pre-conference workshop, and it was specific to the data exchange framework and the role of the QHIOs. So we can go to the next slide. So as I said, just the basics, this was the third annual CMA Health IT Summit. I mentioned it was in San Diego. We had about 200 people registered, most of whom, but actually not all of whom, were physicians and medical group or community health center leaders. Even though this was a CMA event, the Health IT Summit is a little different from our other events in that we try to get a wide swath of the industry to attend so that we can have conversations like we did at this pre-conference workshop. The event happened the afternoon of May 6th. And as I mentioned, we did it in concert with C4BH. Next slide. Big picture, this was our agenda. We started off with a speech by John Ohanian, who did a big picture overview of the data exchange framework. We did kind of a roundtable introduction of all 9 QHIOs. I was very pleased that all 9 QHIOs signed up very quickly to participate in the event and were there not only to introduce themselves, but to be part of our conversation. Timmy did a quick overview of the DXF sandbox. And then I think the part that was really most interesting to those of us who were involved, we did, if you're familiar with the format, we did what's called World Cafe. So we had 5 stations set up, and we had about 50 minutes to do it. So the attendees self-selected which of the 5 stations to start at, and then I'll talk more about this in a minute, but the idea was that every 10 minutes they would get up and move to a different station. So the 5 stations were a DXF 101, patient privacy and consent, DXF technical standards, the DXF sandbox, and then social services data sharing. So we tried to hit 5 of the biggest things that I think we find we get questions from about physicians and medical groups and CHCs, and have a chance for them to discuss and to really have an interactive discussion about what are the concerns, how can we work together, what do we need from each other. And we were really hoping people would lean into that idea. So next slide. Big picture, I think all of us who were involved were really, really excited about the level of engagement. As I mentioned, this was kind of an experiment. It was the first time for this event that we tried something like this. And as recently as that morning, I woke up with just this panic that no one was going to show up. But of the 200 people registered for the event, we were somewhere between 75 and 80 people in the room. So I think about 40% of everyone who registered for the event actually did show up for the pre-conference workshop. And as I kind of mentioned before, during World Cafe, the conversations got so involved, we really struggled to get people to move from place to place because they would, no, we're still talking, leave us alone. And then at the end of the workshop, which was supposed to go for 2 hours and was supposed to lead into our welcome reception, we couldn't get people to leave because they wanted to just keep going. And the conversation continued all throughout the rest of the, the next 24 hours of the summit. So from that perspective, it did show something really important that we wanted to see, which is, folks were really interested. They were really excited. They wanted this opportunity to talk and to be involved, and to get their questions answered, I think was really, really important. And so I think I'd say that was very, very heartening. One thing I meant to say up front, I know, Timmy, because you just came on camera, and a lot of you who are on this call were actually there, were in the room. So by all means, folks, jump in either in the chat box or raise your hand if there's stuff you wanted to mention that you saw in the room. But as I said, I think even the CMA meeting planner folks said they had never seen a pre-conference workshop with this level of excitement and involvement. So that was very exciting. Next slide. Here are the big picture key takeaways. And as I'll talk a little bit more about this in a moment, but at each of our World Cafe stations, we had note takers who took very detailed notes and tried to capture the essence of the conversation. CMA and Connecting for Better Health are actually going to be publishing a white paper we've been working on that tries to capture the conversation, but these are the very big picture ones. So one of the biggest things, and I knew this was going to be an issue, is that for physicians, continued education and outreach is still sorely needed. We had the education and outreach grants a couple of years ago. That was now a couple of years ago. And I think we all know that the DXF came out with a lot of momentum, a lot of fire behind it, and now it's been a few years. There's a lot, a lot has happened, and I think it's the DXF, especially for a lot of the folks who are in that January 2026 cohort, even if they heard about the DXF early on, maybe that information's grown a little stale. And so all of us who work with physicians, we need to be ramping up that messaging again, especially with that January 31st, 2026 deadline coming. Consent management, we know this, it's a huge issue. It still remains very fragmented. We don't really have a good centralized way to handle it. It will be very important as the DXF continues to roll out. We know that interoperability, there are still considerable challenges. Data standardization continues to be a challenge due to inconsistent EHR capabilities and very varied data sharing practices. Hopefully the DXF is meant to address some of that, but it continues to be a concern of a lot of physicians. Next slide, please. I give Timmy and her team a lot of credit. I think there actually was a lot of interest about the DXF Community Sandbox. I think a lot of our folks the CMA folks didn't know it was there, didn't know it was there as a resource. And now I think, hopefully you're seeing an uptick in traffic. I see that you are, that's great. Because I think people are now very interested in this as a place, as a safe space to come and talk, to try things out, to continuing to engage on what we need from each other. And then social services data integration. I will admit, when we were sketching out the World Cafe, I initially was not sure social services data integration, how much of an interest that would be to the physicians coming to the summit. And it was actually in when we sent out a questionnaire ahead of time, it was one of the top things that physicians were asking us about. So I thought that was actually really, really interesting. And we all know there's technical limitations, there's privacy concerns, there's a lot of things we need to work through, but physicians really, really are excited. They're interested in that. They know it's something that they want more information about. And they know it's important for them to know those things about their patients. So that was really interesting to see. Next slide. And so next steps, as I mentioned, Connecting for Better Health and CMA, we put all of our notes together. We are going to be publishing our takeaways jointly. And then one of the things I will throw out is, there's a lot of health events and health IT events around the state. And I think what we did and this sort of unique thing that we tried was so successful that I would love to see other people on this call at other, association events or trade events do something similar. I think it would be really interesting to see if if somebody did something like this in a room that was hospitals or health plans or social services organizations. Would the thoughts and the concerns and the takeaways be the same, or would they be different? So I think, I at least speaking for CMA, and I think I can probably speak for C4BH on this as well. We're happy to share our notes, happy to talk about what we did and how we did it, and as I say, would love to see others take that baton and do similar events. And I think with that, one more slide. Thank you to everyone involved, the C4BH team, you guys were amazing. All the QHIOs who really leaned in and were part of this. Obviously, that was a huge draw for physicians. And as I mentioned, I see a lot of people on this call who were there in the room. So by all means, if you had takeaways or thoughts that I didn't cover, I would love to hear them. And the chat box are coming off mute. And thank you again.
David, thank you so much for this recap. And I think it just really reinforces how much we can't do enough education. We can't do enough discussion. We can't do enough to be able to help organizations and point them where they can get more information, more tools, and be able to really solve some of these issues that they've been, doing workarounds for a number of years. So thank you for your leadership on this and your vision, and for reaching out to us to help partner. And you took words right out of my mouth, which is we would love to do more of these. Yes, I think we have the playbook. We can always, add more time or be able to customize it. But let's get this out there. Let's get the show on the road. So thank you.
Yeah, thank you, Timmy. This was I still actually remember the day last fall when I called you and I was like, so I have this idea, and really appreciated that you took that call and you leaned in with me. As I say, I really did not know this was going to work, and it just shows how much interest there is still out there in data exchange, that it was hugely, hugely successful.
Well, thank you. I know we have other agenda items here. I'll hand it back to Stephanie.
All right. Yep. Oh, yeah, just that last slide. There's my email address if anybody wants to reach out to me. So thank you.
Put it in the chat. Or can you put it in the chat, David?
I will.
Okay, thanks.
Wonderful. Thanks so much, David and team, and everyone who was there that day. Moving on to our California policy updates, we'll do a number of updates in sort of fast and furious succession, but I'm going to hand it over to Max Perret from Aliados Health, who's joined us today to provide a brief update on what is going on with the state budget as we near this June 15th deadline. So Max, I will hand it over to you. I think you might have a slide, so we'll pull ours down and you should be able to share.
Okay. Fantastic. Thanks, Stephanie, and thanks everyone for having me. For those who don't know me, my name is Max Perret. I work at Aliados Health. We're a consortium of 17 health centers across 6 Northern California counties. I'm our senior director of policy and external affairs. Can everyone see my slides?
Yes.
Great. So I wanted to start just very briefly touching on the federal landscape and kind of where we are, just to provide some context, and then I'll talk about the state budget. Basically where we are federally is the federal budget runs from October 1st through September 30th. And during each budget year, Congress can pass one reconciliation bill. And whereas the normal budget process requires 60 votes out of the 100 senators on the Senate side, reconciliation allows for them to pass adjustments to the budget. It has to increase or decrease revenues or spending significantly. And that's basically the Senate parliamentarian determines whether it's significant and whether it passes the quote unquote Byrd rule on the Senate. But they can adjust spending and they can adjust revenue sources with only 51 votes. And so this is kind of their one big shot this fiscal year to enact President Trump's key priorities. And if we remember back to when the Democrats controlled both houses of Congress in the first 2 years of the Biden administration, they passed 2 reconciliation bills. They passed the American Rescue Act, and then they passed the Inflation Reduction Act. Those received no support from Republicans, so they needed to use the reconciliation process to get those bills done. So this is the Republicans' equivalent of that process. It's going to address the key GOP priorities. So Trump refers to it as the one big beautiful bill. It's not limited to just one aspect of their priorities. It addresses immigration. There's billions of dollars for immigration enforcement, detention, deportation. It has some energy provisions, scaling back the Biden administration's clean energy tax credits and other environmental priorities of the previous administration. And it has a pretty big increase in defense spending as well. But the biggest impact fiscally is on the tax cuts. It's continuing all of the tax cuts that the Republicans passed in the last Trump administration. And in order to fund this bill, both the spending and the tax cuts, they need to make cuts to programs. And so that's where Medicaid, which in California is Medi-Cal, comes in, as well as SNAP, which is CalFresh in California, formerly called food stamps, and other large social programs end up being on the chopping block in this bill. It's in order to pay for the tax cuts, the immigration enforcement, and the defense spending. The overall goal of the bill that the White House has set is July 4th. They're unlikely to make that goal because the Senate is having to figure out which aspects of the House bill they want to change. So just very briefly touching on components that impact the healthcare safety net. It would require states to impose a copay, which most states currently do not have, for the adult expansion population, those who were expanded in the Affordable Care Act. It reduces the FMAP, which is the federal share for Medi-Cal for that expansion population, to down from 90%, which is what it currently is for states that serve undocumented immigrants through their Medicaid program. And it requires work requirements for the first time for most states. Currently, only 2 states have work requirements. And you have to go through a waiver process if you want to institute them. This one not only removes the waiver requirement, but actually makes it mandatory that states impose work requirements. It also requires states to conduct eligibility redeterminations at least twice a year. And so we'll see a lot of folks dropping out of Medi-Cal in California if this goes into effect, because not only because of the work requirements, but because of all of the paperwork to prove that you're working, to prove that you're eligible in terms of your income. And a lot of folks are just going to throw up their hands and say, I'm not going to bother to do this. I'll just go without coverage. And so you're going to see an increased uninsured rate, which ultimately will impact both community health centers as well as hospitals, emergency rooms, and the like. It also eliminates the requirement for states to provide Medicaid coverage during a reasonable opportunity period, but it allows the states to continue to do so. So basically, as people are going through the citizenship process, the question is, are they eligible or not eligible? And it also prohibits an increase in provider and MCO taxes, which states use to fund their state Medicaid program. So in California, we passed Prop 35 that made our MCO tax permanent. This is preventing states from increasing that tax to help pay for it. Let's see here. Turning our attention to the state budget, as Stephanie mentioned, the legislature has until June 15th, so just 3 days from now, to pass a budget. If they do not get paid. It's in the state constitution. They have to pass a balanced budget. It's not like the federal government where they can run a deficit. Not an option for the states. And so the governor's proposal included some very concerning components that affect the safety net of our healthcare system. He proposed eliminating acupuncture services. He proposed reinstating Medi-Cal asset limits at a very low rate of $2,000, freezing all new full scope Medi-Cal enrollments for undocumented adults starting next year, having for the first time monthly premiums for undocumented adults starting in 2027, and a big hit to health centers, eliminating PPS payments and turning it into reimbursement at fee-for-service or managed care for the undocumented adults on the program. He also proposed ending long-term care benefits for undocumented adults, as well as full scope dental coverage as well. The legislature has been making their way through this and making adjustments, and the leadership in both the state Senate and the Assembly came together with kind of a compromise between their own competing priorities in pushing back on the governor. It draws down a lot more money from the state reserves. And so it does create a little more risk if there's a recession in the future or a big impact from the federal government when the reconciliation bill goes into effect, which will impact the state. But ultimately, it's a much better proposal than what the governor's May revision to his budget projections proposed. So you can see here on the right-hand side of the screen where they've pushed back. But ultimately, most of the concerns we had in the governor's proposal has basically been pushed back to July 1st, 2027. And if you think about the electoral cycle, right, there will be a new governor, right, who will start in 2027. There will be a new legislature that will start in December 2026. So it will be a new cast of characters who will be having to deal with the budget that time, and we'll know more about what impacts we'll have from the tariffs, right? What impact we'll have from the federal budget cutting state revenues, and what impact any sort of economic growth or recession might happen in the next year or two. The legislature also reduced that premium down to $30 a month, pushed that, delayed that out to July 1st as well, and also exempted seniors, those over 59 from that. And so ultimately a much better bill, although obviously still concerns and still a need to advocate, especially as we continue towards those 2027 deadlines, pushing them out farther or eliminating them ultimately if the state can bring in some additional revenue. I did just want to very briefly put this in context. The state prior to 2016 did not offer undocumented immigrants of any age Medi-Cal, and over these 4 phases has started providing Medi-Cal coverage. And this basically takes us back to pre-2020. Unfortunately, the state, the counties, the state, philanthropy, the hospital systems had various healthcare system kind of contingency programs in place prior to Health for All, and a lot of those have been reduced or eliminated because Medi-Cal expansion has occurred. And so now we have to kind of bring those back, which is going to take a lot of money. And obviously the state does not have a lot of money, and the state's cutting money that's going to the counties. So the counties also don't have a lot of money. And philanthropy also in turn has a lot of competing priorities given the cuts at the federal level. And so we have to make our case to all funders and prospective funders to engage in this work and stress the importance of our healthcare safety net. And with that, I'm happy to take any questions.
Thank you so much, Max. Really appreciate you coming here to share this. There's a few questions in the chat here, mostly about what happens between the 15th and the 30th. Can you speak a little bit about what's likely to happen after June 15th?
Yeah, so the budget needs to go into effect July 1st, right? That's the start of the new fiscal year for the state. The legislature has till June 15th to pass a budget. And then the governor will have a couple of weeks to choose whether to sign it or not. And assuming he signs the budget that the legislature passes, and by the way, the legislative committees have already voted, right? The last couple of days they had hearings, the Assembly Budget Committee has voted, the Senate Budget Committee has voted. So it's going to the floor, and it has until the next 3 days, right, to go to the floor of both the Senate and the House. Presuming they pass the same bill, the governor signs it in the next couple of weeks. It'll go into effect July 1st. But then oftentimes around August, September, they'll come back and start working on any follow-up guidance, implementation, language, et cetera, on components of the budget if they need to clarify things. And this year, that will be more important than ever, because if the federal reconciliation bill passes, let's say in July at some point, they may have to grapple with a big financial hit to the state on top of the projected budget deficit we already have. This bill does not include any projections due to what happens or doesn't happen at the federal level. And so if the SNAP provisions, for example, that affect CalFresh, that passed the House go into effect, the state for the first time is going to have to pick up a share, kind of like how they do on Medi-Cal, right? They're going to have to pick up a state share of funding SNAP benefits. And so that's going to impact the state. It's going to impact the budget, and we'll be having to make our case yet again on not moving some of these delays, right? Moving them sooner, or having cuts to other pieces of the healthcare safety net.
Great.
I'm happy to put my contact information in the chat. I'll also put links. I think one went through, or maybe both went through. Yeah, one went through for the Senate recap on their legislative agreement, and then I'll put the Assembly one as well, just in full context right on that. They're both the same. They're just written differently, and so they kind of stress different points, but it's the same content. They're not different.
Great. One last piece before we let you go, Max. I know Aliado, CPCA, so many other advocates have been coordinating both federal and state budget advocacy efforts. If there are folks on the line today who want to get involved in those, should they send you a note? What's the sort of one call to action for folks who want to make their voice heard on the budget?
Yes. So for the state budget, because the legislature it's imminent, I would say call your own legislators and thank them.
Uh-oh. I think we just lost Max. Okay. Well, you can call your state senator and assembly member, and we'll pop back over to him if he comes back on. But let's go ahead and move ahead. Looking at our time, we're a little short, coming up on the hour here. provide a really brief update on Senate Bill 660. Since the last time we met as a coalition, SB 660 passed both Senate appropriations and the Senate floor, is now in the Assembly, its second house. Thank you again to everyone who supported the bill, lended your voice, time, and other advocacy efforts to get to this place. It's very exciting. The bill is now in the Assembly. It's been referred to both the committees on health and privacy and consumer protection. That means it's going to have 2 policy hearings this summer and 2 opportunities to submit letters of support. So Connecting for Better Health will be coordinating those letters. You will get plenty of reminder emails as we get into July around how to add your logo or how to send your own letter of support. The next deadline we're really looking at is July 18th. July 18th is when the California legislature breaks for summer recess. So bills need to pass their policy committees before then. So between now and July 18th, we'll be preparing for those 2 hearings, and we'll have draft letters for you all in the next couple weeks. But thank you again for everyone who has supported SB 660 thus far. Looking forward to the summer. I think in the interest of time, let's skip ahead. Our legislative update slides are here for folks who want to take a look. We've also pared down our tracker here based on those bills that were held in appropriations and did not move forward from their first house. So we have a somewhat narrower list to follow for the rest of the year. Very briefly, I'm going to pass it over to Maya to give us an update on the RFI that C4BH is responding to. And then we have Julia Murphy here for a last announcement before 12 related to the housing community of practice. So Maya, do you want to talk about the RFI?
Sure. I'll move ahead. You can always find these slides on our website to find more details. So we are responding to this RFI. We thank everyone that came to our office hours and also our advisory group that has informed our answering to these questions so far. We answered 2 questions from the patient and caregiver section, as well as 2 from the provider section. You should have all received a draft email or letter in your email today with the pre-meeting email. And here's just like kind of a quick outline of what our responses were. Really just trying to tailor this letter to align with our policy priorities, and also connect already existing initiatives like the DXF and TEFCA and our community sandbox into the RFI to help inform CMS on how they are going to move forward with their initiatives.
So everyone has our draft in your email. It came this morning. If you have thoughts or comments, we'll take those via email till 12 noon tomorrow. It is due Monday, so we'll finalize it and everyone will get a copy of our final letter. But again, just thank you so much. This response was informed by many of you who shared really, really thoughtful ideas, comments, and feedback over the last 3 weeks of developing it. So really appreciate that.
All right, and then I will pass it over to
Stephanie, could we also just do a call that if others are submitting their own RFI and you're okay with sharing it with us, we would love to see it. And we could even do, you know, we could publish ours and then summarize other thoughts too. I just think this is a great moment that we should all help each other take advantage of it.
Absolutely. Yes, we're happy to post and share others that have been submitted by our partner organizations if you want to share them with our team.
With that, I will pass it over to Julia Murphy, who is going to talk about the Housing Community of Practice survey.
Thanks, Maya. We just wanted to give a brief update on the health and homelessness community of practice and share our expressions of interest survey. So just by way of reminder, Connecting for Better Health is partnering with Homebase and Georgetown to support COCs and MCPs to be able to address the data matching and sharing barriers that we know prevent people who are experiencing homelessness from receiving eligible ECM and CS supports. We, since we met in office hours and got your input and feedback, have held 3 targeted work group sessions. We got really high engagement and interest and great feedback. We had more than 30 COCs in that conversation. We had MCPs from across the state, apart from in 5 counties represented, and we had all of the HMIS vendors in that discussion. We shared the expressions of interest survey a few weeks ago, and we've had good response rate on that as well. We already have 10 COCs who said they'd like to participate, and 6 MCPs covering a good range of geographical sizes and across the state, with overlap in many of the counties. So we're really excited about the level of engagement and interest that we're receiving. We're hoping to launch the community of practice in mid-July to early August. Please do respond to the survey if you're interested. We're closing it next Friday on the 20th. And also share it with your networks as well. If you have COCs or MCPs or other partners that you know are struggling with these issues and would benefit from participating in this kind of initiative to help solve those, so we can all learn together. We want as many people to benefit from this work. So with that, and please do also reach out if you have any questions or would like to learn more. We're available to speak. I can pass back to you, Stephanie, I think.
Thanks so much, Julia. I appreciate everyone on the call who's worked to inform this work and taken the survey or shared interest so far.
And we put the link in the chat real quick to the survey.
Yes, I think it's
And
there.
yes, it's amazing. Oh, there it is. Thank you.
Okay, Timmy, anything else you wanted to add on the community of practice?
I just know we're at the top of the hour here, but this work is so important, and we were just reminded of it this morning where we were on a call with a client that is having issues accessing the API from their HMIS system, and how can we engage the county to be able to ensure that that API is available. And I'm sure all of you who are working in this CalAIM space and trying to better getting the data that organizations need in order to serve their clients are running into this. And here's our opportunity to not only solve it, but once we solve it once, we can then share it with everybody else. So thank you for those of you who have helped us get to where we are today. And I'm really excited to see the kind of interest that's coming. So thank you. And if any of you are having issues with working with your HMIS systems, reach out to us, because we will inventory it and figure out how to block and tackle.
Okay, just to wrap us up right before 12, I think we can go to our upcoming events on the next slide. I just wanted to put a plug that the Technical Advisory Committee, now the TAC, is having their second consent focus group right now. It started at 12 right after our meetings. Rim Cothran gave an overview of the consent work group on our last meeting, so encourage folks to tune into those. We also know that a number of our Connecting for Better Health Coalition members are on that committee and will be participating in these 4 focus groups. So we look forward to having more conversations as a coalition around the process and what's being discussed. In addition, number of conferences coming up here where we'll be at. As always, please share additional events that you would like us to have on our radar. And we can always share your organization's webinars, conferences, events, and our materials as well. And I think with that, we can wrap up for the day. Thanks so much, everyone. It was nice to see you all. Hope you have a good rest of your Thursday.